Hi, everybody. I'm Dr. Toni Engram and just wanted to give you a little bit of information today about myself and about the practice Flourish Dental Boutique in Richardson, Texas, and give you a little background on holistic or biological dentistry. So I hope it answers some of our most common questions that we get asked. So let's jump in. I'm going to hide my screen so that you can see the slideshow. And let's dig in. A lot of people ask just about me, myself, and I'm small town, local girl. I grew up in Hillsboro. I did my undergrad at TCU in Fort Worth and went to Baylor for dental school. In 2017, I believe it was, I completed an integrative health coaching program and members of some really great organizations in dentistry. The main one that I'm certified through and accredited through is the IAOMT, or the International Academy of Oral Medicine and Toxicology. And I'm a former person with Crohn's disease. So, Crohn's disease, I was diagnosed in 2011 and I had a brand new practice. I had a toddler at home. I was also working full time as an associate dentist, was not taking very good care of myself at the time. I was just busy. I was busy with life and started having all of these symptoms, and it took several months to figure out what it was. When I was finally diagnosed, the physician came to me and told me, he said, here are your prescriptions that I want you to start taking right away. He said, we're gonna wean you off the steroid pretty soon, but these other medications you're gonna be on permanently, long term, until they no longer work. And when they no longer work, we're gonna put you on stronger medications. And there's a good chance at some point you are going to need surgery to remove all or part of your colon. So I was not very excited about it. I was not accepting of it. It just didn't seem right. I didn't identify as a person who was sick and who would have a chronic illness the rest of my life. So I took the medications for a time being, but then really started to go down the rabbit hole of how do I actually heal myself? And is it possible to heal myself from Crohn's disease and actually get well? And thankfully, praise God, I went into remission very quickly. As I continued to heal and get better, I was able to wean myself off the medications and have never looked back since. And that's been almost 10 years ago now. So, as I was going through that journey myself, I really started to feel like a hypocrite if I couldn't figure out how to do the same thing for my patients, because there are so many correlations. Crohn's disease is an inflammatory condition caused by a bacterial imbalance. Well, tooth decay, gum disease, both of those are bacterial imbalances. Gum disease is primarily an inflammatory condition. So there are so many correlations. I thought there has to be a way to be able to help my patients heal from their chronic illnesses too. And that's what led me down the path of oral systemic health and studying the links between your oral health and the health of the rest of your body. And then the patients in my first practice in Midlothian, they really kind of nudged me the rest of the way. And they would say to me, oh, you're studying all these things, you're into all this nutrition now, but what about fluoride? Why are you still using fluoride? Or they would say to me, oh, well, if you believe these things, why aren't you protecting yourself from mercury when you remove amalgam fillings? So my patients really encouraged me to keep learning, to keep growing. And that is what led me to holistic and biological dentistry, and is why I am here today. So we exist because, first and foremost, dentistry should be safe. Second, we believe that the health of your mouth is intricately related to your overall health. And third, you were meant to flourish. And really, you need a dentist. So there are three schools of thought here on why you need a dentist. The first one is kind of the old school, our grandpa's school of thought, which is a correct answer. And that is, teeth are important. You need them to chew, to kiss, to smile. It impacts your facial structure. Good dentistry and bad dentistry, good teeth and not so good teeth, those can all be life-changing things. So you absolutely need a dentist, whether your teeth are in good shape or not. Whether you have teeth or not, you need a dentist. Now there's a more modern view to why you need a dentist that's also correct. So we know now that tooth decay and gum disease are directly correlated to an increased risk of heart attack and stroke. They're directly linked to pregnancy complications, issues with autoimmune conditions, how well you control those autoimmune conditions, type 2 diabetes. All of those things are connected to the health of your mouth. And this is mainstream. This is backed by current peer-reviewed, solid scientific journals. There was a study done by United Healthcare that showed that patients with gum disease, those who got their gum disease treated, actually spent less in medical costs, not dental, but less in medical costs than those who didn't get their gum disease treated. So it actually saves the insurance companies money when you get your mouth healthy and you keep it healthy. There was a study in the Journal of the American Heart Association called Circulation, where they took 100 patients who were having a heart attack, and they took samples of the clots that were in those coronary arteries, the clots that were actually causing the heart attack, and put them under a microscope. And surprisingly, not surprisingly to some of us, but surprisingly to them, 40% of those samples had gum disease related bacteria in them. Gum disease in 40% of those samples. What completely blew them away is that in 70% of those samples, they found tooth-borne bacteria from tooth decay related infections. So, insane amount of correlation between heart disease and mouth infections in general. And then your overall inflammatory burden. We know that our bodies have it rough and we do a lot of damage to them. If you've got gum disease, any kind of inflammatory condition that's in your mouth, then it's going to impact your other inflammatory conditions also. There's also a third correct answer to why you need a dentist. So not only do holistic dentists know that the oral systemic connection is incredibly strong, but we also know that your teeth are connected energetically along the different meridians to different organs and systems throughout the body. So a wisdom tooth might lie along the same meridian as your heart or your small intestine. So a problem in one could mask itself as a problem in another. We also have an appreciation for your overall toxic burden. We want to make sure that anything that we do in your mouth helps to lessen that toxic burden and not add to it. And then, of course, the mind-body connection is so strong. We know that everything that you think and believe has an impact on your overall health, and that is no different in dentistry than it is in any other area of medicine. So, what is exactly holistic dentistry? Well, in our office, we look at the whole person, just like the name implies. We value prevention over treatment. We operate with a first do no harm mentality. We're looking for the root cause of disease. I want to know why you have gum disease or why you have that cavity so that we can get to what's causing it first so you don't get any more. We appreciate the healing power of nutrition because it truly does have the power to heal. And we use safer products, techniques, and materials. Now, biological dentistry a lot of times is used interchangeably. A lot of times I'll use it interchangeably with holistic, but there is a difference. So biological dentistry is more specific, has a more specific definition. Biological dentistry is holistic and it is integrative. Holistic would be kind of the more overarching umbrella term. But biological dentistry is based on the concept of German biological medicine, which believes that sickness and health is determined by the overall toxic load on your body, or the toxic load on your extracellular matrix, that stuff that's between your cells. A lot of times we'll call it the biological terrain. So in biological dentistry, we want to remove any specific barrier to your optimal health, and we want to tread lightly on your biological terrain. We want to do as little to negatively impact you as humanly possible. Now, what does that actually look like? This is a question we get on the phone a lot. How are you different than a regular dentist, quote unquote, regular dentist? So we don't use fluoride in the office. And I would, you can go to obviously any dentist and you can ask them not to do the fluoride treatment at the end of your cleaning, and that's fine. But it does go far beyond that in our office. There tends to be fluoride hiding in many, many, many different dental specific products, including things that we don't necessarily look for to have fluoride. Our bonding materials, our composite filling materials, the floss that we used to buy for our kids was even, was treated with fluoride. So we work to make sure that we actually have no fluoride in the office at all, which can be challenging for sure. And not only do we not use fluoride, but we still want to help people therapeutically treat their cavities. And so we provide fluoride alternatives, things like xylitol and ozone and remineralizing toothpaste that can prevent and treat cavities very, very well without the use of fluoride. And obviously we don't use the amalgam silver fillings that are 50% mercury, but we go beyond that. We go beyond the standard of care because we are a mercury safe practice, or we practice what's called smart amalgam removal. And SMART is it's literally an acronym that stands for Safe Mercury Amalgam Removal Technique. And that was formulated by the AIAOMT to help standardize the process of removing amalgam fillings so that patients and dental personnel were exposed to as little mercury as possible when removing old fillings. We use ozone throughout the office. Almost every single procedure that you can get here will use ozone in one form or another. We ozonate the water that we use. We use it all kinds of ways. We have a CBCT, or a cone beam CT, and that's basically a 3-dimensional x-ray. What's amazing is that it has less radiation than the 2D x-ray machine that I bought 10 years ago. They just keep getting better and better, using less and less radiation. So they are safer. Every new model that comes out is a little safer than the one before. And so I'm so excited to be able to have the cone beam technology in the office. It helps us see everything in your mouth in 3 dimension, can help screen for any airway issues, as well as looking at root canals and wisdom teeth and all kinds of things that we couldn't see in 3 dimension ever before. Low radiation, again, digital x-rays get better each year. We also, anybody can say that they are a holistic dentist, because it's not a true recognized, official specialty recognized by the American Dental Association. So anybody can say they're a holistic dentist, but you want to look for somebody who has some training and education in biological dentistry, so that you know what to expect when you go in the office. You want to make sure that they have an understanding of the oral systemic health connections. You want your dentist to know how what's going on in your mouth might affect your type 2 diabetes or your autoimmune illness that you might have, how it might affect your unborn child. So another thing that we are really proud of is our collaboration with and knowledge of other like-minded providers in the area. So we really value our relationships with our area chiropractors and naturopaths, our functional medicine doctors, our holistic doctors. We are able to help people get well so much faster when we work together. And it's not just about me working with my patients, it's me working with my patients and the rest of their healthcare team, whatever that team might look like. And it's not just people with doctor in front of their name either. We have lymphatic therapists that we are excited to work with, physical therapists, we have biofeedback practitioners. And so we're very excited to have everybody on board, get everybody on the same page so that we get you well as quick as possible. And then I think it's nice if you have a provider that's willing to think outside the box. So things like root canals, cavitations, the things that might be buzzwords on the internet, you have to be willing to look at things a little differently than dental school taught us to look at things. Other services, a lot of people will ask us, oh, well, you do this holistic stuff, do you still do dentures, or do you still do extractions? So typically the answer is mostly yes. We do most of the other normal dental things, cleanings, crowns, extractions, all the normal dental things. Yes, we do see kids. I love seeing kids. That's how I got my start in dentistry. It was at a pediatric office. And so we enjoy a wide variety of general dentistry services. We just do them with a more holistic treatment philosophy. And like I said, we try to tread more lightly on the biological terrain with those. Some people ask, and it always makes me laugh a little bit, that people would assume that we might not do drugs or anesthetic or anything like that. So yes, to set the record straight, we do prescribe antibiotics if and when they are needed and necessary. I will even do anti-anxiety medication, medications that will help calm your nerves before a large dental appointment, especially. And yes, I do use numbing shots or local anesthetic, because I want to make sure that Again, it's still on the principle of first do no harm. We want to do as little as needed, but as little as needed, sometimes we need a little bit of help. We need a little bit of temporary help from a pharmaceutical to make sure that you have a comfortable enough experience that it gets you healthier. If you're so anxious that you can't sleep the night before, your stomach is in knots before a dental appointment, then to me, I think that's a detriment to your health. So yes, we still use medications if and when they are needed and necessary. And every dentist, every holistic dentist is going to be different in their beliefs and their approach. But there are some really nice, high caliber organizations that have sought to bring some standardization to how we practice. Two of the biggest ones are the AIAOMT, where I have my accreditation and my SMART certification. Another large group I'm a member of, the International Academy of Biological Dentistry and Medicine. There's also the Holistic Dental Association and the American Academy for Oral Systemic Health. And then some holistic dentists will seek out other forms of education that are outside of the dental realm as well. Like mine was my integrative health coaching certificate. Some will even go so far as to get a naturopathic degree. And my promise to you is when you come in my office, you will receive dental care that meets and exceeds the standard of care established by the state dental board. So please understand that holistic dentistry does not mean we are cutting corners. It doesn't mean we're skipping steps. It means we're going above and beyond what we feel like is the best care possible. I promise you will be treated with respect and a high level of service. And if you're ever not, then I want to know about it. I'm willing to collaborate with your other providers to make sure you get the best outcome. And we will empower you to make the best healthcare decisions you can for yourself. So your body, always your decision, but my job is to give you the best information that I can and empower you to make those decisions and be comfortable with those decisions. Because again, we believe dentistry should be safe. And the health of your mouth is so important to your overall health. And I absolutely believe that we were all meant to flourish. So I hope that answers a few of your questions. Feel free to look around, see any other videos that we have posted. Look around our website at www.flourish.dental. Look on our social media accounts because we keep a lot of information there too. And if we can answer any questions you have, feel free to reach out and let us know. Thanks so much.